Good morning and assalamu alaikum. It's a pleasure to be here, of course, in Dubai. It's my countless trip I've been here. Thank you so much for the warm invitation and introduction from our host.
Introducing BrainBridge, the world's first revolutionary concept for a head transplant machine, which uses state-of-the-art robotics and artificial intelligence to conduct complete head and face transplantation procedures, ensuring smooth outcomes and faster recoveries. Because head transplants require high speed, precision, and efficiency, BrainBridge utilizes advanced high-speed, high-precision robotic systems to speed up the process, eliminate human error, prevent brain cell degradation, and ensure seamless compatibility. The head transplant procedure involves removing a person's entire head containing the brain from their current diseased body, then attaching it to the body of a healthy, young, brain-dead donor. Head transplants could provide individuals with severe medical conditions such as terminal cancer, paralysis, spinal cord injuries, or neurodegenerative diseases the opportunity to have a fully functional body while preserving their consciousness, memories, and cognitive abilities. The neurons are the longest-lasting functional cells in the human body, and according to our estimates, the brain is capable of lasting several hundred years, provided that the rest of the body remains young. The BrainBridge concept involves the use of the integrated robotics platform comprised of the two autonomous surgical robots, designed to perform simultaneous surgeries on two bodies side by side within a single setup. The complete robotization of the process allows for the surgery to be performed in an environment with varying temperature and pressure. The procedure begins by preparing the donor and recipient bodies. The donor is a brain-dead patient who has a functional body with vital organs in good condition, while the recipient is the patient whose head will be transplanted onto the new body. General anesthesia is administered to both the recipient and the donor. Both patients undergo tracheotomy, with a tube inserted into the trachea to provide respiratory support and facilitate mechanical ventilation. Our proprietary artificial plasma solution is administered to both the recipient and the donor. This solution is designed to keep the brain and body oxygenated, prevent clotting, and allow for safe operation at low temperatures.
Don't worry, no one's going to be transplanting brain anytime soon. This is a concept by BrainBridge that came out a few months ago, created a lot of noise in the surgical fraternity around what was possible. Swami, in his opening keynote, talked about the downloading of emotions, the downloading of your memories. What about changing the entire body for another one? Changing your head for another one? So this is obviously sci-fi, but it just shows you what people are thinking about in the world of surgery, my discipline. So the topic of today is around how AI could be my co-pilot in my operating theatre. I've been a surgeon now for over 3 decades. I've survived the NHS for 30 years. I've survived about 10 health ministers and countless governments. So I'm still here thinking about what the future concept might hold. So if you go back a fraction, about 10 years ago, Sergio Canavero, an Italian surgeon, had the concept of performing a head transplant. It was headline news. That was his patient that he picked, Mr. Spiridonov from Russia, who had a neurodegenerative disorder, saying that he'll be the first person to be transplanted. A lot of noise, a lot of ethics around this. Is it possible? Is it the right thing to do? What about the rates of complications and ultimately potentially death? Canavero was thought to be a maverick. He was thought to be dangerous. But actually, where we are now, we are needing people thinking differently, disrupting healthcare, to redesign, to reimagine, to remodel, and to rethink the model of healthcare. Healthcare is fundamentally broken around the world. The NHS is finding it difficult to look after the patients of 60 million patients. The US system is also broken with a GDP of 20%. We can't carry on endlessly pushing money to healthcare. We're not thinking about how we can be smarter, more efficient, using the same resources in a different way. That's the future of healthcare. And for all of us to think about how that might happen as we go forward. I'm also a student of history, but if we go back about 1,000 years, about 1000 AD, Al-Zarawi is a surgeon who was based in Andalusia in the southern part of Spain during the Moorish community, and he was thought to be the father of modern surgery, and ultimately he was an Arab. he wrote a book called Al-Tasrif, which was then translated to Latin called the Liber Theorici. The Liber Theorici became the embodiment of surgical practice and innovation, not for 1 year, not for 5 years, but for 600 years, even through the Renaissance period. There was no other innovation taking place. That takes us back to the concept of slow innovation, of incremental change. This is my hospital I work in, as it was before. The Royal London Hospital has been around since 1740. And the other hospital I work at, it's St. Bart's. And as you can see, last year, we celebrated 900 years of existence, one of the oldest hospitals in the world. And we've had a history of innovation and kind of people who push the boundaries of what's possible in the science of medicine and surgery. There's some famous alumni. So people in medicine want some of these people, of course. Some of these people, like Percival Potts, described the fractures of the back and, of course, part of the limbs. William Harvey was the first person at Barts and the world to describe the circulation of blood. Without him, digital health was not a thing. Without circulation, without understanding the blood flow and the parameters, we are now, of course, living in a world of digital innovation and healthcare. James Paget described Paget's disease of the bone. Well, importantly, you might know this person here. He wrote an essay called The Shaking Palsy, as you can see. That was James Parkinson, who first described Parkinson's disease, who was based at Barts Hospital. So we've had many famous alumni over the course of 900 years. I mentioned Al-Zahawi, the surgeon, who wrote the book in the year 1000 AD. And we show incremental change, slow change. And medicine slowly is resistant to change. Healthcare workers are slow to adopt change. We're not disruptive enough, hence why systems fundamentally broken. Charles Darwin, of course, you know, alumni from Clare College, Cambridge, but also at UCL, where I teach at the Global Business School for Healthcare. Charles Darwin described what we all know, the theory of evolution, slow incremental change. Over millions of years, humans evolve, society changes. And so we kind of accept part of that conversation around slow incremental change. In 1970, that was challenged by Stephen Gould from Harvard University, a professor there who said, actually, it's not about incremental change. He described something called punctuated equilibrium. What did he describe? He says society goes very, very slowly, evolving over millions of years. However, occasionally, something happens to change our trajectory. Society moves in a different direction, being pushed by some external force. What does he mean? Well, he talks about episodes of our society, whether the advent of fire takes us from Neanderthal man, something much more sophisticated. The electricity suddenly brought electricity to homes. The motor car, the aeroplane, transportation allows to travel and become part of the third industrial revolution. Now, of course, Charles Babbage, with the invention of the computer, has taken to the fourth industrial revolution. So we are seeing changes take place every now and then that change our society. The most recent one of punctuated equilibrium was COVID. We have now evolved and changed, had to radically think our ideas in healthcare, being more remote, managing patients on a remote basis. But of course, it's not about one technology. It's about the convergence. Over the last 10 years, there's been new language of medicine. Yes, digital health is a concept. But actually what we're seeing now are these words behind me, whether it's AI, deep machine learning, nanobiotechnology, genomics, 5G, quantum computing, wearable sensors, big data, et cetera, There's a new language. And medicine is one vertical they all converge to. Yes, other industries like fintech and others are great, but healthcare is where all these technologies converge and impact the lives of our patients. Another concept I want to bring you to before I go into the full discussion on AI is our windows into humanity. To my mind, there are three windows into humanity. The first one is the telescope. When Galileo produced the telescope and Copernicus decided that the Earth revolved around the sun was center of our universe, that was the advent of the telescope, looking far-reaching into the world. Next one was the microscope, looking deep into microorganisms, the structures of cells. Leeuwenhoek created the first microscope. So the first window into humanity was the telescope. The second one is the microscope. There's a third. The third window to humanity is data and AI. It reaches into our data, into who we are, how we behave. So we are now in the third window of humanity. And we are now in that window as we speak. The world of surgery has changed. I took this video about 5 years ago from the World Government Summit where I spoke here in Dubai. And we looked at the concept of the future OR. It be incorporating all the technologies, for example, AI, machine learning, computer vision, computer systems, robots, for example, 3D printing, all coming together to create the future operating theatre. But actually what we think about is the three windows that I've seen in my lifetime. As you've seen, I've been a cancer surgeon for 30 years. I'm a colorectal cancer specialist. What we've seen is changes taking place. When I first started, I was what was called a maximally invasive surgery. I made big cuts from here to here, from here to here, as big as I possibly could, getting my hands in, everything. That was how we started. The bigger the cut, the better almost. We then moved to era, about 20 years ago, into laparoscopic keyhole surgery. That was our second change into innovation. Now we're looking at the world of robots and robotics. So in my lifetime, I've seen a change take place very quickly from maximally invasive surgery to minimally invasive surgery and now automated, autonomous surgery used by robots. It's been a change, of course. People have mentioned digital health a long time, for the last 15 years. And everyone who I come across, the influencers, all claim to be the people who first thought about digital health, right? So many of them. But actually, the next concept in my mind is digital surgery. It's a new concept. And these are the 5 pillars that I think underpin my future as a surgeon. Of course, we're more connected. We are living in a hyper-connected world with 5G, 6G, 7G, and beyond. And of course, Starlink, connecting parts of the world that weren't connected before. We are doing remote collaboration, remote telementoring, training people remotely across continents, across the world. Data AI will give us insights into our abilities as a surgeon, but also how we look at outcome measurements, look at how we assess people's performance. Of course, the robots are in. We're now living in a war. There's kind of war of robots going on, where more and more robots are becoming more disruptive, more democratic, more affordable across the globe. And my own world, I spent a long time in extended reality and whole XR, and I think I want to be opening keynotes talking about VR now is here. Now we'll see how that pans out. I'll cover all those topics in this keynote. AI is busy. A lot of money, a lot of investments. And this is just a tip of the iceberg of people investing into AI comes to healthcare. Remember, healthcare is trillions and trillions of dollars of money being invested, of course, across the world. Whether it's been imaging, it's doctor-facing, like in telehealth, for example, drug discovery, and we'll cover some of these topics over the next 30 minutes or so. It's a busy environment, so you should understand what's going on. If you're a VC or investor or private equity, or you're the coalface, you want to be involved in that conversation where AI is going to change our world forever. One of my colleagues wrote a review on AI in surgery. Ewan Harrison from Edinburgh wrote a little review article in The Lancet just a year ago saying, what does that mean for us as surgeons? It's worth having a read of his summary around what the concept might be. Let's go back a fraction. Diagnostics. We know that diagnostics has been the key kind of discipline that AI is going to disrupt. You know? In fact, they said by 2019 or 2020 that radiologists will be obsolete because AI will take over the role of radiologist. They also, Elon Musk, remember, he said that Tesla cars will overtake human drivers and there will be no human drivers fairly soon because of autonomous cars. In 2024, I saw a great picture of a radiologist driving a car into work. Okay, neither have become obsolete over those 5 or 10 years. But what does AI sit there? It means that we can automate, make life more efficient. This is the first paper called the CHEXNet. This was from Stanford University. They looked at chest X-ray with pneumonia as a diagnosis. And they asked 1 and 2 radiologists to look at the diagnosis. They compared the 2 radiologists to a computer algorithm, AI. The AI was better. at predicting pneumonia because it looks at images. Image analysis is easy. It's low-hanging fruit for AI. Of course, we know that. Whether it's, for example, chest X-ray, or indeed, this is Viz AI, a company based out in the UK and the US, looking at report, so this is Cure AI, they've taken the X-rays to the next level. It's an Indian company, the largest AI company in diagnostics for imaging around the world. So they've looked at all these areas, whether it's TB reporting, lung nodule management, musculoskeletal reporting, and of course heart failure. Now you can buy their product on a global level. So they've taken that whole concept of AI imaging to the next level. Kira Medical are from Cambridge in the UK. They've just been bought out by Open Medical. And what they've done is looking at breast mammograms. So as a surgeon, if you're a breast cancer specialist, for example, you'll now be able to look at mammograms with a higher degree of sensitivity and specificity around mammographic interpretation of breast cancer. Much faster, much quicker. We have a dearth of radiologists around the world. We don't have enough healthcare workers. We are short. How do you optimize that? Well, AI would help us make it much faster, much quicker, because we can use that same technology to automate our work. Viz AI are looking at head CT scans for somebody who's had a stroke, for example. And we know that if you have a hemorrhagic stroke compared to an embolic stroke, i.e. a clot, the clot can be dissolved very quickly and the stroke reversed, but it has to be diagnosed fairly quickly. So what they've done with this, put into a workflow. It's not about just the diagnosis, it's put into a workflow. So the image comes up, the AI will say to you, this is a clot, you go straight to the treatment center, saving about an hour of time. The hour is a golden hour. It means you can reverse people's stroke and debilitating disease. So you're showing that not just is about using AI, it's putting a workflow to improve outcomes for patients. The Google DeepMind team in London, who I know quite well, looked at retinal scans, of course, for ophthalmology, and they could predict retinal scans. For example, looking at retinopathy for diabetics, predicting the disease, of course, using their OCT scans. Amazing amount of work going forward. We've seen it used in dermatology. Dermatology is quite key, and pathology. So all the disciplines you can think of with images are now being disrupted with AI algorithms. This is interesting. These are skin analytics. We're now seeing people walk into rooms or having camera systems looking at their skin to be able to diagnose skin lesions. Whether it's a squamous cell carcinoma, basal cell carcinoma, benign lesion, it's pretty accurate. Of course, this introduces bias. A lot of these companies who built these AI platforms built it on Caucasian patients, white people. So it's great at diagnosing skin lesions on white people. When it comes to brown or black people, it's hopeless. That shows inherent bias in some of our AI. We've got to be very careful how we use heterogeneity, bring a patient mix that makes more sense, ensure that AI can actually support everybody in a system of healthcare. So bias is a crucial one. I'm a colorectal surgeon, and I do a lot of endoscopy and colonoscopy. Here's a colonoscopy, and colonoscopies are used to look at polyps. And we look at cancers, and we take biopsies, diagnosis. But sometimes we get the early lesions called polyps, and they will become cancers in about 5 or 10 years. If you remove them early enough, you prevent the cancer. It's called the adenoma carcinoma sequence. So here's a colonoscopy. Can you put your hands up as soon as you can see the polyp? No hands going up. Can you see it now? Yes, I was the world's worst endoscopist, let me tell you, right? And I would have missed much bigger lesions than that one. We would have missed that one. And that, if you're left alone for over a few years, become cancer. That's assisting us, supporting us, our co-pilot in the world of surgery, picking out lesions, saying, hey, look at here again, I've seen something, are you sure? You remove it, that's preventing a cancer in the future and reducing costs for the healthcare system. When I did my PhD in the US at Princeton and the UK back in the year 2000, the Human Genome Project has just been unraveled at a cost of $1 billion across different hospitals and different universities and genomic centers. The sequencing of the genome was a monumental shift in understanding of science, an episode of punctuated equilibrium. It changed our society forever, understanding our human genome. Look at the cost now. From $1 billion when we first started, you can now have your genome sequenced for about $100. Amazing. Look at Moore's law. It's irrelevant. We are now in exponential change, where even Moore's law cannot predict our future. But of course, we're seeing the unraveling of this genome, which will help us. You may have seen the team from Google DeepMind, Demis Hassabis, who was the inventor of Google DeepMind, who just won the Nobel Prize for Chemistry because he unraveled a 50-year challenge of the protein folding. So they now have created Deep AlphaFold, open source. Anybody can now sequence, look at protein folding very fast, which means we can now use it for detection of DNA and RNA mutations, but also then think about how we do drug discovery much faster. It takes 10, 15 years to produce a drug. With AI now, we've had the third drug produced purely using AI. Fast tracking. Within 2-3 years, you have many drugs out in the market that are much faster, much quicker. So the world of surgery is not just about surgery. It's about the whole concept of the technologies that will help us from diagnostics, from genomics, to treat our patients as well as surgery, which we'll talk about in a moment. I always ask the audience, where were you on 9/11? And everyone in the world who's old enough remembers exactly where they were. If I ask anyone in the audience, you know exactly where you are, with clarity. It was a monumental shift in our thinking and where we were at that time. Then I asked the audience another question. Where were you on 30th of November 2022? No one can remember. No one can remember, right? Where the hell was I? Something more fundamental happened on that day than 9/11. Would you believe me if I say that? The launch of ChatGPT. It changed our world forever. LLMs, AI, suddenly became available, affordable, and accessible. It's changed our society. It's an episode of Punctuated Equilibrium by Stephen Gould. It's changed our society. We've shifted. A cataclysmic shift, a seismic shift into the world of AI. Of course, now AI, with ChatGPT, can pass the US exams. It can become a doctor. Doesn't say much about the US exams. I'm just kidding, of course, right? It can also be more empathetic. Can we bring empathy? Can ChatGPT be more empathetic than me? Hey, I'm a surgeon. It's fairly easy to be more empathetic than a surgeon, of course it is, right? But could we challenge the way we think about our patients? We have a global problem, ladies and gentlemen. We have a healthcare issue that's fundamentally across the world. It's one of the few challenges we have that are global, the workforce shortage. If you talk about to every CEO in the world, of every hospital, one thing on their mind is how do we solve the global healthcare workforce shortage? We're going to be 15 to 20 million health workers short by 2020, according to the WHO and the UN. We can optimize healthcare by producing chatbots and having these kind of tools at our disposal, and we've seen many of these being used as a first interface for triage for patients. A chatbot that's intelligent, that answers questions about your diagnosis. We've just launched a new platform. Ali Parsa is a good friend of mine. He worked on 2 global companies. He's built 2 unicorns. The first one was Circle Health, a private provider. Then he launched Babylon Health, a telemedicine AI kind of platform, which went to an IPO in the US. Ultimately, it didn't succeed. And now we just built a new one called Quadrivia, which is an AI platform, which launched as beta mode about 3 weeks ago. And it's a comprehensive AI clinical assistant built by clinicians for clinicians and for the patients we serve.
Probably the most important and universal challenge in all of healthcare everywhere in the world is that the demand for health services far exceeds our ability to meet them.
We have brought together clinical leaders and healthcare innovators from around the world to help create Q. And here they are, introducing Q.
Hi there, I'm Dr. Fernandez. Tell me a bit about you.
Hi, Dr. Fernandez. I'm Q, a comprehensive AI clinical assistant built by clinicians, for clinicians, and the patients we serve.
Great. Can you walk me through in more detail what you can do? For instance, how can you help in a typical consultation process?
Sure. So when dealing with a patient who comes for a new consultation, I can manage history taking, provide some hypotheses, suggest investigations, propose appropriate treatment plans, and recommend local specialists.
How about managing a patient with a chronic condition?
I can help with the ongoing management of patients and help with any routine clinical workflows across a wide range of conditions. Some of these workflows have already been prepared, but clinicians can also build their own custom workflows to support their patients better.
That's very useful. Can you talk through what makes you special?
I'd love to. I have a robust cognitive architecture that comes from the orchestration of LLM-based systems tailored to perform specific tasks or subtasks. These are known as agents. Using those agents, I provide responses grounded in my clinical knowledge base, which combines a range of sources and medical guidelines that are then validated by our clinicians to minimize hallucinations. Finally, I aim to combine all this with a patient's health record, which brings together data from EHR systems, clinical notes, and previous patient conversations.
And how do you ensure safety?
I'm constantly on the lookout for red flag symptoms that might require emergency attention or that may be indicative of critical issues. If patients ever mention symptoms that are a cause for concern, I will redirect them to get support from a real-world clinician to ensure that the patient's safety is never compromised.
That's enough for now. We'll have more videos to follow, and we'll let people test you for themselves.
That sounds great. I have lots to improve on, but I can't wait to support clinicians all around the world. See you soon.
हम लोग सब साथ मिलकर स्वास्थ्य की सबसे बड़ी समस्याओं का समाधान कर सकते हैं.
Q بعدها مثل صبية عندها كتير تتعلم.
Tell us how we can make Q better. Together, we can make Q the best clinical assistant that we in healthcare have ever seen.
So we've launched Q to help support this workforce issue, to look at workflow. Thank you so much. It's really kind. Thank you. Oh. So look, we think about how do we solve the healthcare issues. AI will help us support us. It won't replace doctors. It'll help us support some of the fundamental issues we have around shortages, efficiencies, etc. And in fact, these are the areas we're already working on and building many more experiences where QI will help us navigate that clinical journey of a patient. But of course, I used it for the first time in my clinic a few weeks ago. I thought, let's experiment. And I'm a colorectal surgeon, so I used it to take a history of a patient before they came to see me. 20 minutes of their time, taking history.
Yes, I'd like to start.
And this is what we did.
Great. The aim of this check-in is to gather some information about your symptoms ahead of your coloproctology appointment. This will help the doctor to understand your condition better. Is that okay with you?
Yes.
Thank you. Could you please describe your symptoms for me? If you're experiencing any pain or discomfort, please include details like when it started, what it feels like.
That takes 20 minutes for patients' time before they see me. When I see them, that is on a PDF file, inserted in the electronic health record with all the key data points inserted so you can do some research. It saves 20 minutes of my time. I can spend my time treating, speaking about the consent, etc. It makes my time more efficient. Imagine the whole flow, post-op recovery, drug treatment, drug compliance, all being automated. We see clinical workflow as touch points. People see me in clinic, I see them for a few minutes, they go away, have diagnosis, they come back, for example, they come back again for the operation. There are touch points throughout the career. What if it was continuous? They could access a doctor anytime. Information like Dr. Google. That's much more robust and much more based on clinical science. That's kind of what we're doing. This is the kind of the architecture, and it's all open source. It's on our white paper, and we want partnerships, of course, around the world to build it efficiently to make sure it's safe as possible. So do join us on that mission. If you think about the flow of patients, the first point of contact will not be a human being. It will be AI chatbot. Number one, have a conversation. This is hemoptysis, coughing up blood, serious symptom. You don't need to see a human being for that. The AI will say, hey, have a chest X-ray or CT scan, which is diagnosed by AI modeling. You then have a biopsy. That's a robot-guided AI navigation tool that takes the right part of the lung to take the biopsy. You want a surgery, it can be done remotely from any part of the world using robots and 5G connectivity or Starlink. And of course, the biopsy and pathology results is automated by pathologists. The whole process now can be automated through AI technologies, making it much more efficient. And so we're seeing now the world of surgery being automated. One of the things about surgery is that we're very much analog. We're moving to a digital world now. You see, in the operating theatre, when I'm operating, the outcome is based on two variables: my intuition and my judgment. which is what's been driving 30 years of my existence. What if it could be aided by digital technologies, whether it's using these kind of images overlaid in real time in spinal surgery or other kinds of operations to allow us to navigate through operations. My friend Maki Sugimoto, using XR and AI technology, is overlaying information in real time on the patient. Pretty raw at the moment, pretty fundamental, but it will get better, allowing us to avoid structures that we shouldn't be damaging, showing you the outcome of cancer and how much you take out, for example. We're seeing these kind of technologies being used as we speak. This is training in VR, for example, and we are seeing now the training. This is training using AI, simple technology, allowing you to train a surgeon using keyhole surgery, but using AI to assess their performance and competence and let them improve over the course of time. It's not subjective anymore. We've got objective evidence of outcomes and performance. That's what our patients deserve. That's what we deserve. That's how we want to train the future generations. I've built many companies. I'm an entrepreneur. This is one based on education and AI.
Hey Judy, how are you?
Hello, I've been feeling rather unwell since the bee sting a few days ago. My hand is swollen and inflamed, and it's causing me a lot of discomfort.
Can you tell me what is an appendicectomy?
An appendicectomy is a surgical procedure to remove the appendix, a small pouch-like organ attached to the large intestine.
So we're using that AI ChatGPT LLMs inserted into an XR training platform to allow people to be simulated training using AI technology. Of course, many of us have Teslas, and yesterday Ali drove me at top speed at midnight around Dubai in his P100, right? Gosh, it was so fast, right? I'm still recovering, right? But we're now looking at the world of autonomous cars, right? And it's good to see other industries, see how health will change, to find out their experiences. Of course, when we look at these autonomous vehicles and how they're going to use computer vision and cameras to navigate, I think about surgery, my own discipline, how we use computer vision to allow us to navigate through a surgical procedure. I think, Ali, you did have your hands on the steering wheel last night, right? You did, yeah, I'm sure you did, right? It wasn't completely autonomous, okay? All right, so imagine an operation. This is a cholecystectomy, a gallbladder being removed, which we do routinely for gallstones disease. There's one area that we worry about, which is the common bile duct. If you damage that structure, it's serious, it's litigation, it's complicated for the patients, and reconstructive surgery with lots of morbidity. What if we could be aided to area using computer vision, saying, hey, during the operation, avoid this area. We think this is dangerous for you. Supporting you from a digital perspective, making it more objective, allowing us to suddenly not just rely on years of experience and intuition. We make mistakes. It's who we are. We have complications. This is navigation tools, of course, using these technologies. And this is some work done in the US for the first time, feeding information from many operations over the course of time. So it's allow us to hopefully be better surgeons, improve our outcomes, improve the efficiency, and give us valuable tools during the procedure. We're now seeing other technologies coming in, of course, navigation through surgical procedures, as I said before, using CTs, MRIs, overlay, and using AI as an interface to allow us to navigate successfully through a procedure. It's exciting, right? It's not sci-fi anymore. It's not Tony Stark. This is actually real that we're seeing now in getting FDA approval, EU approval, CA marking, etc., around what's available in the future. A few years ago, I saw this little grainy picture that came out. The first autonomous surgeon, a robot, joining two bits of bowel together. Apparently, it did it as good as a surgeon with a less leak rate. That grainy picture has not been replaced or reproduced any time since. So I wonder about the authenticity of that video. But it showed where we're heading towards, where surgeons could be automated and supported through a surgical procedure. We always thought we couldn't be replaced. Well, actually, we can be augmented in many ways in our profession. Robots are in, and the robots are so exciting. The world of robots are becoming smaller, more sleeker, more smarter, and more precise. It allows us to be more precise in our surgery, whether it's microsurgery, open surgery, or indeed advanced pelvic surgery, which I do for a living. So robots are now in, they're much more affordable than they were before. Of course, Da Vinci was the first robot from Intuitive about 25 years ago, and now we're seeing a kind of a plethora of different robots out on the market. What we saw 25 years ago was the first transatlantic operation. So Jacques Marescot from ERCAD in France was in New York. The patient was in Paris, and the operation took place transcontinentally, and it was that gallbladder operation I showed you earlier. It's 25 years ago. We moved on, and more recently we saw the whole concept of remote surgery and remote telementoring take a new fold, especially during COVID, when we had to think differently about our work. And now we saw the first operation in China, in the Eastern Province, being performed in 2019 using 5G technology. As you know, 5G has a super fast bandwidth, a download speed of 2, 3, 4 gigabytes per second, and a latency of 0.1 milliseconds, imperceptible. Imagine 6G, 7G, 10G, whatever coming in to make it much, much more faster and much quicker for us. I mentioned earlier, the third window to humanity is data. Hence, AI is our third window. So big data is coming in. We're now seeing things like the OR black box. Imagine in the OR, every device connected, data coming through into a central OR black box, giving you all the information about what's going on in the operating room. If things go wrong, you can go back, interrogate the OR black box, find out what that case was and what happened. Much more objective than sitting around the room saying, well, what happened, and figure out between people, which is error-prone. So this is Theodore Granchov's work from Stanford. He was actually in Toronto before. Now Stanford uses the OR black box. One of the companies I advised called Vitvio. Vitvio were part of the team that developed Amazon Go. Amazon Go is a shop that you go into, take all the bits you want, walk out, and it charges you onto your account, right? Amazon Go. Not quite true. It's apparently some Indians watching a video, ticking things actually on a box. They got found out, right? It wasn't as autonomous as it should have been, right? Same team said, we can do more in the OR. They produced this. They put computer vision cameras in using AR platforms and showing you what could be possible to improve efficiency in the OR. So now they look at this is the OR now. We're looking at images, we're looking at people's movements, efficiency, how the theatre trays are handled, how the instruments are taken away. We're now looking at everything in the OR, and they're just about to launch their first pilot in the UK in January. They already work with the Mayo Clinic and others to produce the future OR. So that video I showed you earlier about the future OR in Dubai that took 5 years ago at the World Government Summit is now becoming more transparent. It's where we're heading towards. We're just ahead of our time almost. So now we're seeing these kind of things being used. Now, you would never think a surgeon would sit here, talk about these technologies, and put the other things together. There's a blockchain summit, yes. There's other summits, a game summit. But I'm going to talk about all those things in one conversation. I'm going to talk to you about the metaverse. Who knew? I've been involved in virtual reality and XR training for about 15 years, at the very forefront of it all. And I've been building the concept of the metaverse. So if you don't know, Neil Stephenson was an author who wrote the book Snow Crash in 1992, almost before the birth of the internet. He described in his book a dystopian society that was fundamentally broken. People in that book were escaping the real world that was broken. Societal breakdown, financial meltdown. They were escaping to a world that he described as the metaverse. That's the first time that word was used in 1992 in a book by Neil Stephenson called Snow Crash. But of course, I am thinking about this metaverse. What does it mean? It's much more complicated than a simple concept. This was me in 2017. That's my avatar in a virtual world, collaborating with people from around the world. Hi, everybody.
Hi, Shafi.
So the HoloLens itself really allows us to reshape the way we connect people, we communicate with people, and also to be used in teaching and training. Initially, when you put the HoloLens on, it feels a bit strange, but actually within a few minutes, it becomes quite normal. You feel as though you're just discussing cases with people in the same room, for example, like we do in normal hospital practice.
we can come in and actually look at this content in full 3D. And obviously when you're working in this case, the medical field, having a full 3D understanding of a situation, for example, is really much more powerful in solidifying how you want to navigate it in your mind.
That's not sci-fi. I did that 5 years ago in 2017. I had 3 surgeons in 3 parts of the world connected through a HoloLens device. A surgeon, a colleague of mine from Tata Memorial in Mumbai, one of the best cancer hospital in India. We had a surgeon from America, and I was in London, connected through a simple connection through a smartphone and a head device as avatars in our virtual worlds. The first concept of the surgical metaverse. So we were building this, and you never thought a surgeon would sit here to talk to you about Web3 in the metaverse, right? I'm sure that wasn't on your agenda today. We're building the future of the health metaverse. We're building Web3 technologies. As you know, Web3 is not just one element, it's a number of elements, whether it's blockchain, whether it's AI, whether it's deep machine learning, avatars, holograms, etc. We're building the whole concept, what we think is the world's first metaverse. We partner with NVIDIA, for example, working with Unreal Engine 5, bring you that world metaverse. So we've been building that for about 3 years. We have our own token, token out for 2.5 years, the AIMX token, which has gone up in value a little bit over the last few years, which is encouraging for us. But we're working out, how does that work? How does the financial model work in the web metaverse? How do you transact, not just using fiat currency? How do you use cryptocurrency? How do you make this whole concept of the health metaverse work? We've launched our first worlds to the public. And these are the worlds we've launched already. We've launched about 6, 7 worlds now. With Japan, Australia, and Dubai. We launched the Middle East only recently. So now you can come and enter our metaverse, either buy land, access healthcare, access content, access education. It's all based around a web browser and also XR headset. It's not about the VR headset. It's based around the experience that you have in our metaverse. This is one of the examples.
Welcome to the next level of healthcare, AMEDES, the world's first Web3 healthcare platform. Presenting blockchain, NFT and AIMS use cases with our partner Voix Clinics Australia. Blockchain-backed medical records and patient data make sure the system is fully compliant with international healthcare standards while keeping up trustworthy records, right and access management. Patients feel safe as their records are backed by blockchain transaction IDs and full transparency when it comes to access to their data through healthcare institutions and providers. NFTs preserve the intellectual property and make sure patients are able to be incentivized, for example, for participating in clinical trials. Medical consultations are being recorded on-chain to make sure insurance companies and patients can follow up on healthcare services performed, a big plus in transparency. The AIMX token is being used to incentivize users for supporting others, for example, in patient groups or training sessions. Digital training and education certificates are being issued as NFTs and make recording and professional training easy and transparent as never before. Prescriptions and payments, for example, with the AMEDES token AIMX on-chain, generate a new way of safety, transparency, and simplicity. Discover the future of healthcare with Voix Clinics and AMEDES Avalon. In Australia and many other places in the world.
So we launched that first. We're just launching a world's first virtual medical school, creating all kinds of learning experiences in our metaverse and Web3. So we built a medical school in the Caribbean. Why not? You can dream, right, in the metaverse. it's a continuum of learning. We think you have face-to-face, which is still crucial for clinical training. You can't get away from it. It's crucial to be close to human beings and to interact. There's the online e-learning platforms that we've been using for the last few years since COVID, like Zoom and telemedicine platforms. And then there's the whole concept of the virtuals and the metaverse. It's just a continuum of ways of teach and learn and to provide clinical practice. Of course, I have my own lecture theatre in my metaverse. And I taught my medical students for the first time during COVID in my metaverse, because we had to be remote. I said, just jump into my metaverse, I'll teach you, I taught a whole module curriculum, because we had the technology always available already around this concept of the metaverse. This is my auditorium. So next time, hopefully, when I see you, you'll come to my metaverse and see me virtually, rather than traveling all the way to Dubai, which is quite expensive and of course not great for the climate and everything else in terms of travel expenses. That's my auditorium. Ladies and gentlemen, I've taken a journey. If you want to hear more about the work that we do, I run another platform called Surgery International to bring all that latest information to you. We launched it 2 years ago, so it's a free service. If there's what's going on in the world of healthcare, feel free to launch into that. That's the news station that we have to bring you the latest concept and design thinking. I run my own podcast, of course, called Talk Surgery, where I talk to the future leaders around the world, so it's available on all those platforms as we speak. And if you want more information, just follow me on LinkedIn. Healthcare is so exciting. We're living through amazing changes. I think we can refashion, remodel, rethink, and kind of redesign the future of healthcare. Thank you very much.